So, good morning everyone. Today we'll discuss something about a case of severe dengue fever. So, what is meant by severe dengue fever? What are the normal dengue fever? So, one more thing is what I want to discuss today is I want to discuss whole and soul of the dengue fever. So, what is meant by dengue fever? Who are the major risk factors to got mortality rate in the dengue fever, and whom to admit, whom to observe, whom to admit in ICU, whom to admit in general ward, and whom to discharge, and whom to see only on OPD basis. So we'll discuss today whole and soul about the dengue fever. So as we know, all the theory parts about what is meant by dengue and what is its mechanism, everything you know. But I want to discuss something which is not there in the everyone, like every easily books. So what is it? Depending on the practical guidelines, that is the WHO guidelines. Usually a dengue fever is first, like 2 years back, dengue fever is divided into 2 to 3 types. First is dengue fever with warning signs, dengue fever with shock. In shock also, first, second, third, fourth grade they have classified. But recent guidelines tell that there are some specific conditions which we have to observe very nicely. So what is meant by dengue now? Dengue is nothing. Only one thing we have to take consideration in dengue fever is we have to take consideration there is a capillary leak. You know there is a dengue. What are the fever in typhoid fever? There will be a evening race like intermittent fever, which change of what do you call it? Sometimes fever will be there, sometimes not there. So this is a 3 to 4 days fever with severe headache and everything. In dengue fever, the type of fever will be a fever with myalgia and periorbital pain and mild headache and generalized weakness. So this generalized weakness counts a lot in the patient of dengue fever. So what you have to do, you have to during investigation during 3 days every outside the hospital in every OPD basis they will treat for 3 days. After 3 days patient will getting like he will get, if it is not relieved, everyone will get for the investigation. So investigation if the patient got dengue fever, that is dengue negative, then the NS1 IgG IgM is there. So NS1 positive IgM, what is meant by NS1 IgG and IgM? So NS1 means there will be a like sudden if the dengue is started today, so there will be only NS1, it will show the positive, IgG and IgM will be negative. So when IgG will shows this after 7 days, there will be a IgG also positive. And what if the IgM also positive means sometimes it can be taken as dengue NS1 positive, IgG positive means yes, this is a full course of dengue fever that is lasting 2 to 3 days or 7 days. If the IgM is positive means what you have to think is, if the IgM is positive means maybe a dengue fever reducing now, if the patient condition is normal, if the patient's vitals everything is normal and IgM is positive means what you have to think is yes, dengue fever is reducing now. So if the patient is having worsen his conditions, even NS1 positive, IgG positive and IgM positive, everything is positive means it is a full-fledged dengue fever. So this to be taken consideration. And one more thing is everyone are thinking that platelets. So in dengue fever there will be a thrombocytopenia. But some people are think that in every first investigation if the patient is having thrombocytopenia and some they will do for the dengue test and dengue test will be negative but still they are having thrombocytopenia. So why this occurs? This occurs because of the febrile thrombocytopenia. Means that there are some viral fever which is having some thrombocytopenia actions. So because of the thrombocytopenia actions, there will be a reduced, like patient will have same features of dengue fever with dengue negative by the lab investigations. So what you have to do is we have to see for the all the clinical signs. So in patient, yes, we know that dengue during when you are sit in a OPD, patient have blood in patient. Some patient they will come with in tertiary care or secondary care. Usually they will come with the blood investigations. They will come with the dengue. They will come with some blood investigation showing that severe thrombocytopenia and some investigation dengue fever positive. So let's consider one this patient. He is a 45-year male patient. So he came to complaining of dengue fever and myalgia since 3 days. After 3 days, his fever is reduced. That is, febrile phase is reduced now. Only thing what is having is now is he's having a severe generalized body ache and generalized weakness, and she is having some giddiness on and off. So these are the consideration. What you have to do is I have examined for everything. So in dengue fever, usually only one thing you have to keep in mind is there will be a capillary leak. Because of the capillary leak, the patient may have some third space volume losses. So in patient is having already thrombocytopenia, whom to first I will discuss some condition like if the patient is having thrombocytopenia, dengue positive, NS1, IgM, everything is positive, and now patient having severe platelet count. Let's think about 20,000. So what we have to do is we have to see even a 20,000 platelet or 50,000 platelet doesn't matter. What matters is you have to think whether this patient is having any warning signs or not. So let's define what is warning signs. So warning signs are nothing but if the patient is having critically diagnosed dengue, clinically or lably diagnosed dengue fever, what are the warning signs? Warning signs are nothing but patient is having abdominal discomfort, vomiting, nausea even after taking food. So this is one, and second one is patient is having postural hypotension. So patient is having some giddiness. Okay. Next one warning sign is patient is having hypotension, tachycardia, and some bleeding activities. It may be through the gums, it may be through the small capillaries. Here you have to see the platelet count, like in patient of platelet severe thrombocytopenia. Where you have to assess for the bleeding is we have to assess from the mouth. Oral cavity is the first to be assessed, and any other wounds and anything to be ruled out. So these are the warning signs. If it is there means and these are the clinical warning signs. There are some warning signs which are related to laboratories. So what are the laboratories warning signs? Laboratory warning signs nothing but there is something called hematocrit. So this hematocrit is very important to be discussed in all the dengue fever. So only hematocrit only can you can divide the patient whether the patient is severe or whether the patient is serious or not. So let's what is meant by hematocrit? Hematocrit nothing but it will it will give the clue of patient how the dilution factor. We know that dengue fever is having some capillary leakage. Because of the capillary leakage, there will be inside the blood vessel there will be everything blood plasma fluid to come out of the vessels. So it will come inside the cellulars. So it will come extravascularly, intracellularly. So this is the mechanism. So what you have to do if the patient, let's think that if the patient is having a severe thrombocytopenia anything, and one thing is hematocrit is too raised. What is meant by hematocrit? Is in the male patient and female patient. Usually in a female 35 to 40 is the ratio. In both male and female 35 to 40 is the ratio. Let's think that if anything raised more than 20% of the normal hematocrit raised, it means we have to consider that yes, he is having some capillary leakage and he is having something extra, like he is in third place volume loss. So what you have to do is you are in dengue danger signs. First, nausea, vomiting, febrile, and thrombocyte, like giddiness, postural hypotension, tachycardia, hypotension. Along all these things, what you have to see for the laboratories. From the laboratory, only one thing you have to do is hematocrit. In case of hematocrit, if the patient is having high hematocrit, what you have to do is we have to check for the yes, patient is having high hematocrit, maybe a capillary leakage. So this leakage capillary, where it gone? Either it may form some ascites, either it may form some pleural effusion, either it may form pedal edema or increased JVP, any periorbital swelling. So these are the third place volume loss. We have to see all these third place volume loss from clinically. Only thing, what are the, like, yes, we know everything is happened, third place volume loss is there, but in which is the most common volume loss is patient is having bilateral crepitations. So what is meant by bilateral crepitations? Bilateral crepitations is nothing but yes, patient is having third place volume loss. That third place volume loss going into he is developing some pleural effusion. So it may be a large or small. Yes, we know both side bilateral pleural effusion with basal crepitations in the bilateral. It directly indicates that the patient is having some serious conditions, like he is having some warning signs and hematocrit raised, bilateral crepitations were there, mild pedal edema is there. So this is a very risk factor. So whom to admit means in the patient is having without a warning signs, dengue everything is clinically positive, but if you having mild thrombocytopenia, even that patient also we can send by the home like OPD basis. How we have to send this? We have to see all these things. Patient is having either pedal edema, basal crepitations, hypotension, tachycardia or bradycardia, anything. If the vitals are stable, then you have to directly OPD wise you can send, and after 2 days you have to take him a follow up. So in patient of having all these signs, like he was having dengue signs with without a shock. Dengue, all the warning signs without a shock means we have to keep in a general ward. We can also keep in general ward. We have to see all the warning signs and vitals were stable, like he is having normal BP, pulse, everything. We have to keep in a general ward also. We can observe everything. And whom to take in ICU? ICU patient only one take. Like a patient is having all the warning signs with a shock. So what is meant by shock? Shock is nothing but not a hypotension is not a shock. So even after correctioning the IV fluids, even after giving IV fluids, everything, so patient is not getting his BP. So it may be a shock. So that's why in this kind of patient we have to shift to the ICU. So this is a mechanism. Only one thing is, in treatment purpose, antibiotic. First I will treatment whole and soul of the treatment. Antibiotic first, there is no need of antibiotic in dengue fever. We know there is no need of antibiotic in dengue fever, but sometimes some doctors will give antibiotic. Why? Because there will be chances of secondary infections. There will be chances of, yes, patient is having long-standing like what like ICU or any other wards. There will be secondary infection chances. So if it is counting for the same, we have to go for the antibiotic. If he is not having any secondaries, anything, there is no need of any treatment. And one more thing is, what are the IV fluids? Yes, IV fluids has a major role in dengue fever and any other fever. IV fluids took a major role. So if the hematocrit, by depending on hematocrit, you have to give the IV fluids. Yes, if the hematocrit too raised means, what you have to do is, yes, hematocrit too raised, there will be a dilutional factor, there will be capillary leak. Inside the vessel there is no fluid content. So what you have to do is, we have to give some IV fluids. And after giving IV fluids, if the patient BP everything is normal, we have to stop. And hematocrit, if the hematocrit is raised and we are given IV fluid, that hematocrit next after 6 hours we have to repeat the hematocrit. If the hematocrit is normal, like it came to 20 degree normal range, then you have to stop the IV fluids. And IV fluids should not be given in the patient of low hematocrit. What to do if the already patient is in low hematocrit, it should never be given IV fluids. So this is one thing. And one more thing, there are some circulatory factors. What is meant by circulatory factors? Like patient is having dengue and everything. So low perfusion, like how to assess the patient is shocked? Like we have to simple test: capillary refilling, urine output, BP, pulse. These are very very important. What is meant by capillary refilling? Usually you have to press like this and you have to release. If the capillary refilling takes within 1 second or max to 3 seconds. If it is more than 3 seconds, there will be maybe a shock factor going on. And one more thing is BP hypotension even after giving IV fluids. Second point. Third point is urine output. So what are the urine output to be in normal patient? What you have to take is consideration 0.5 mg per kg per hour. So this is a normal. You should not be every time. There is no need to calculate. Roughly we can give like 30 ml per hour can be taken as a consideration. If it is less than 30 ml per hour, so this should be taken as a shock patient. And one more thing is in patient of steroids. Yes, steroids in actually WHO criteria there is no need to give a steroids. So why there in institute wise some doctors are prefer to give steroids, some doctors are not prefer to give steroids, and some doctors give steroids because if the patient is non-diabetic, and in this case you can easily give the steroids. If it is diabetic everything, there is definitely no need of steroids. And one more thing is like platelet transfusion. So what is meant by like when to transfuse the platelet? Even I am telling, if the patient is not having any bleeding manifestations, even after the platelet, when to give the platelet is only some deadline criteria is there. Less than 10,000 is there means you have to give the platelets. And only thing is even after like he is having platelet count 20,000, 30,000 with bleeding manifestation, immediately platelets should be removed. And the patient is having like 50,000 platelet count and he is taken for any surgery. So this should be, the thrombocytopenia should be managed with the platelet count, platelet transfusion. So these are some criteria. And one more thing you have to do is comorbidities. What is meant by comorbidity? If the patient is having any diabetic history and the patient is having any severe like old CVA or any ISD patient, they are taking ecosprin, everything, these to be ruled out. If it is there means you have to transiently hold this, not permanently. You have to hold for this sometimes to develop normal platelets, after that to be started. So only thing is you can make a clear that yes, these are the conditions. We have to see in any patient of OPD patient, we have to see whether he is having any warning signs or not. BP is there, pulse is there. So whom to take and whom not to take, whom to admit and whom not to admit. This is a whole and soul of dengue fever. And thank you.